Hello and welcome to Government in Focus. I am Leeron Brumell, your host for tonight, and the conversation is on COVID-19 and government's response to and how you can get the latest information on what is happening, how to get tested if you needs be, how to go into isolation, how do we go from there, and how the task force is functioning. My guests tonight, Prime Minister Brigadier Mark Phillips and the Minister of Health, Dr. Frank Anthony. Gentlemen, good evening and thank you very much for joining us.
Well, thank you very much for having me on the program.
Good evening to our viewers. Good evening, Dr. Frank.
I think we've got just a bit of a slight delay, so the response is going to be just about a half of a second off. Not to worry about that. It happens with technology and the transmission from our studio. You'll get me much faster than you'll get Prime Minister and, of course, Dr. Anthony. Gentlemen, going into your second week of being in government, thanks very much for being here and having to deal with the pandemic of itself. Let me start with Brigadier Phillips as we talk about the new task force, COVID-19 task force. How is that working and what is your composition like, Prime Minister?
Well, thank you, Lee. I can tell you up front and tell our viewers that the new COVID-19 task force is working to my satisfaction. It was a campaign promise where we assume in office. One of the first things we will do is to address the manner in which COVID-19 pandemic in Guyana. Program with His Excellency President Ali, and we did promise the people that. And what we did on our first day of work, meet among ourselves as ministers, and we
I think we're getting some bit of interruption in Prime Minister's video. We're going to see if he connects back.
We have a COVID-19 response unit.
Dr. Anthony, let me bring you in here at this point. I think Prime Minister's video is having a bit of an issue. We're talking COVID-19. Ghana has recorded 25 new COVID-19 cases. We're up to 674, but we've got almost half of those in recoveries. How is the Ministry of Health dealing with this pandemic at this point in time?
Well, there are a number of things that we are doing. First of all, we have identified the areas where we're getting the cases from. So, for example, we have noticed a number of cases in Region 9, Region 7. We had a few cases in 8, and we are having a few cases in Region 4. And once we see the trend in these regions, we have started to take measures to ensure that we can contain the virus within these areas and to isolate people so that they don't spread and spread the virus to other persons. So we have been doing that, and for example, in Region 8, where we had an issue not so long ago, we have been able over the last week or so to contain the cases in Region 8. So that has dropped significantly. And we are now working on 7 and in 9 to make sure that we can bring those cases under control. It is a challenging task because, as you know, this disease is spread by droplets and aerosols, meaning that if somebody has the virus and they're infected, they can easily infect someone else if they are close to them, if they're talking to them, if they're sneezing or, any of those things in the presence of another person. And if you're within that 6 feet range, you can easily get infected, especially if you're not wearing a mask. So it is a challenge to contain it, and that is why we have been talking to people to take the necessary precautions, especially wearing a mask, because around the world, and all the scientific evidence has shown that if you wear a face covering or you wear a mask, that this is very protective. We have an order that has been there. We came in and met it, and we've extended that order. One section of that order talks about wearing mask in public and also in inside, like in public buildings, that you should wear masks. And so we think that is a good policy that would interrupt and stop transmission. And therefore, we are urging people and asking people to ensure that when they're in the public, that they do wear their mask.
We get that. Earlier this week, there was a bit of a scare. Two ministers of cabinet coming down with or testing positive for COVID-19. What's an update on them? How are they doing? How is the cabinet feeling, having two of their members, two of their colleagues, contracting the COVID-19 virus?
Well, the disease itself is very interesting because there's a percentage of people who would not have any signs or symptoms, yet they can be infected and they can be transmitting the disease. And with our two colleagues, they really did not have any signs or symptoms of COVID. So they were totally unaware. It was just when we did the precautionary tests that we discovered that they were infected. And so as of now, I've been in contact with them. And up to now, they really don't have any signs or symptoms. They're doing well, and but they have to, as our protocols are in place, they're self-isolating so that they would stay by themselves in a room in their home, so that they cannot be in contact with anyone else, so that infection, there wouldn't be any transmission, so to speak.
Dr. Anthony, I see Prime Minister Phillips is back in the conversation. Prime Minister, glad to have you back. You were telling us about the composition of the National Task Force, and they were operating to your satisfaction.
Yes, we went through a restructuring, so we have basically flattened the whole bureaucratic organization that was there before, and we have an organization structure now that is more responsive to the needs of the people. And as Dr. Frank Anti may have mentioned before, we have at the top a team that is responsible for coordinating our efforts throughout Guyana, and at the same time to liaise with our donors and our international partners to seek whatever assistance we can get coming from overseas to help in this effort. For example, we have PAHO representative, we have CARICOM, and we have the UNDP, and that body at the top, that COVID-19 response unit, is responsible for coordinating our local efforts and to coordinate the support from donor agencies. At the bottom of that, we have two arms basically. We have a medical response arm, and we have an economic and social response arm. And we have a small team that works as a secretariat to coordinate the two arms. And that team works out of the office of the Ministry of Health. So all in all, within our first week, we went through an organizational restructuring, and we have started to deliver as we had promised the people, both on the medical side, and Dr. Frank Anthony will talk better about that and some of the revelations, and also on the economic and social response side, where we are giving out hampers, sanitation supplies, masks, and other equipment to people, Guyanese people all over Guyana. And over last weekend, we went into the interior. We concentrated on regions 8 and 9, and we were able to reach our people in the remote areas of Region 8 and 9, very close to the border. And that is something that has not been happening before we assume office. So I'm quite satisfied with the work we've done over the first week, and we are gearing for the continuation of our activities over the coming week. And of course, there's a lot of focus on what we call the hotspots in regions 8, regions 9, region 7, region 1.
Prime Minister, critical to what you're talking about here in terms of the coordination among these agencies, and as you mentioned, moving into the regions and looking at the border town, is enforcement of these measures to ensure that we here at home are safe. How is that effort going to be coordinated? Has that been reviewed and have more resources in terms of human resources been sent to these regions now that the focus is on 7, 8, 9, and 1?
Yes, certainly. We recognize that our human resources is kind of limited in some area, but if we have an interagency approach to dealing with this pandemic, it means that we can do a better job. And therefore, we have all the agencies of government are now better coordinated in their efforts in working not only in the hotspots, but throughout Guyana. We've had meetings where we coordinated our activities. We have the Guyana Police Force, the Guyana Defense Force, the Civil Defense Commission, the Ministry of Forestry, the Ministry of Natural Resources, the Ministry of Health. All of us are now working together on this effort to curb the spread of COVID-19 in Guyana and to bring relief and support to the people in the remote areas and to the people along the coast who are vulnerable. As you know, a lot of people are out of jobs now, and we have to reach out. Even though they may not have COVID-19, they're affected by COVID-19 because a lot of businesses are closed down or not as operating as it used to before, especially in the private sector. Many of the public service and public sector workers are not necessarily feeling the economic impact. But what we have found out is many of the workers who work in the private sector, they're the ones who are severely affected. Many of the small business people, the farmers, they're affected and they need relief measures now. And that is the effort of the Economic and Social Committee of our COVID-19 response group.
And that ties into what Vice President Barjagdio spoke about on Friday at his press conference, and how do you reopen the economy and cater for COVID-19 in this pandemic. And it brings me into Dr. Anthony here as well. And you started to talk about it before we brought Prime Minister Phillips back into it. Wearing your masks in public and now in public buildings, the enforcement of this more or less has to come from whichever ministry or whichever public space you go into. And as I asked Prime Minister Phillips a little while ago, enforcement of that, how are we going to deal with that in these offices, in these places, should you find that people are flouting them?
Well, actually, the order provide for if you don't do it, it's an offense, and you can get a fine and so forth. But we don't want to go down that road. What we want is for people to practice these things. We need to educate people for them to understand that these laws are there to protect all of us, to keep all of us safe. And I think if we collaborate, then many of these things would be implemented without being harsh in a sense. But everybody got to take on the responsibility of doing the right things. Now, one of the ways that we can help with the enforcement, whichever public space you're going in, whoever is operating that public space must demand the standard that we have set. So for example, if you have to keep your 6 feet apart in a public space, then let's make sure that we make the provisions, we put the markings and so inside the building so that people can easily understand and adhere to these rules. Similarly, if we put notices up in prominent places and spaces so that people can see them readily, I think it would help with the enforcement. So this is a collective effort. Everyone would have a role to play, whether you are a patron to that service or whether you are operating the service. There are roles and responsibility for everyone. And I think once we start doing that, all of us would be safer. So if we want the collective to be safer, if we are alarmed that, we are getting an increase in the number of cases, then what we have to do is practice the preventative measures. And once we do that, we will see the numbers coming down. Now, I want to maybe say something to your listeners as well. Over the last couple of days, you would have noticed that we have had an increase in cases. Now, one of the reasons why we are getting an increase in cases, it is because we have increased the amount of tests that we have been doing. So when we weren't testing, maybe we had this disease and we didn't know how many people had it because we weren't doing enough testing. Even now, we are not doing as much testing as we would like, but we have significantly ramped up the amount of testing that we are doing. And as we test more people, we are finding more positives. And I want people to understand that. But by finding more positives, we are able to take action, and that the actions that we are taking is isolating people so that they are not in contact to continue the transmission. And this is very important. There might be persons who we have not been able to get to as yet, but if they have any signs or symptoms of the disease, we are asking them to stay at home and to call the hotline so that we can send the relevant medical personnel to assist them. So, again, it's a collective thing. We all have to work together so that we can ensure our collective safety.
Minister Anthony, while you talk about that and we're talking about the collective need and we're noting that the cases are going up, have you completed an assessment of all the beds and our capacity in this country, given that a lot of countries are talking about a second wave and the virus peaking? Have we gotten to our peak one? Have you completed an assessment of capacity? I recall there were about 5 places that have been identified for beds in the event that we had so many cases popping up at one time. Have you done that as yet?
Yes, we do have several assessments, but there are a number of different models that we have. Some of those models are predicting high numbers, others are a little bit more moderate. But we have been working with these models and preparing for the worst case scenario. Now, one type of bed that you would need if people become severely infected are the ICU beds. And to prepare for those, it would mean that you will have to get equipment such as ventilators and so forth. So while our major capacity has been at the Georgetown Hospital, we have been exploring the other regional hospitals, and we are looking at how we can increase their capacity, put the right types of equipment, train our physicians who are out there to be able to handle some of these cases, so that not all the severe cases would have to come to Georgetown once we have properly equipped the regional hospitals. So that is a work in progress because many of them did not have the type of equipment and the things necessary for us to have those, what you might say, the ICU beds in those regional hospitals. It would take us maybe a few weeks for us to bring that, the type of equipment and the other necessary things to get those areas up to speed, because we have to import some of these things. But those assessments have been made, and we are working on that to upgrade them, so to speak.
All right, let me bring Prime Minister Phillips back into the conversation. You spoke earlier about coordinating and getting aid and relief out to the people. One, what is your timeline? What is government looking at in terms of getting the assistance? And we're talking here about cleaning supplies, PPEs, personal protective equipment for persons going out into the fields. And I'll tie that into the second part of it. Government has also talked, and Prime Minister Irfan Ali, President, I beg your pardon, Irfan Ali, has spoken about the $4.5 billion direct assistance. How is that coming along right now? And how will that be disbursed if a formula or a system has been worked out for it as yet?
Well, you know, in terms of figures, Dr. Francati could give you a lot of figures.
Yeah.
Okay, but I can tell you a lot from the time we got into office. There's been a lot of goodwill, and there's been a lot of stuff being delivered for us to help us in this effort. A lot of supplies. Dr. Francanti can give you the figures, but not only what is was donated, but in terms of our plans, we want to ensure that we have adequate testing kits, we have adequate PPEs, that is the protective clothing for the frontline workers. Okay, we want to ensure, as Dr. Francanti mentioned, beds, machines, and everything. So I will now ask Dr. Anthony to give you some details.
So one of the things that we are doing is trying, first of all, we have worked with a number of the donors to make sure that we have adequate supplies. And we are also using Government of Guyana resources to buy some of these equipment and supplies that we need. Right now, over the last couple of days, we have received a substantial donation from PAHO, close to $1 million US worth of supplies. Just yesterday, we have received another set of supplies from the government of China. And when people cannot provide the actual things that we are asking for, a lot of them have been providing monies so that we can use those monies to purchase the things that we need. So in terms of the mobilization of resources, the President and Prime Minister and so on has been very proactive in that direction, talking to the various countries and helping us to mobilize those resources so that we can have enough of these PPEs in country. Now, once it gets into the country, we need to make sure that it's going out. And so the health response per se, we have what is called the Health Emergency Operations Center. And through that center, we have been distributing PPEs. One of the things that I've said to the staff of the Health Emergency Operations Center is that we need to make sure that the stock levels in the region are kept at a high level so that nobody can complain that they don't have masks or the right type of mask or gowns or whatever it is that they need. We have been able to procure goggles, face shields, masks, the right types of masks. We have both surgical and N95 masks, the gowns, foot covers, everything that our frontline workers would need to protect themselves. And we want to ensure that it's properly distributed so that the people who are interfacing with sick patients can have all the necessary things to protect themselves and so that they can deliver quality care. This is ongoing. You also ask about sanitation supplies. And again, through the HEOC, we have been distributing sanitation supplies to the region. And part of the work of that team is whenever we find a COVID positive patient, if they need assistance to sanitize their environment, the HEOC team, the environmental section, would provide that type of assistance. So we have been very busy and very active, assisting a lot of people. And then whenever there's a positive person, we would talk to that person, make an assessment whether that person can self-isolate, or if they don't have the means to self-isolate, we will then encourage that person and bring them in to one of our isolation centers. Persons who would have been in contact with the COVID positive person and might have had exposure, we would talk to them to self-quarantine. If they don't have the conditions to do self-quarantine, then we'll bring them into one of our facilities so that they can be in a safe environment, and we can observe them to see whether or not they'll have any signs and symptoms of COVID-19. So this is an ongoing process, and you know, we have been getting a lot of cooperation. We have been getting a lot of help from the private sector, and we want this to continue. As Prime Minister said, one of the things that we have been looking at carefully is how we can work with the various stakeholders to open up sections of the economy. This would have to be a collaborative effort, and of course, the ministry and the task force, we are establishing clear guidelines, and once people are able to abide and enforce these guidelines, then certainly we would work with them to open up that section of the economy. But again, this would have to be collaborative. And if based on the epidemiology, we are seeing that cases in particular areas and so forth, then we'll take the measures that is necessary to protect people as a whole. In other countries, you will see things go up, and they would open up a little bit. And then if things get really bad, you will have to shut things down again. And that has been the pattern in many countries. And I guess the same thing would happen here. We would have these ups and downs, but at the same time, we want to ensure that people are safe. And I'm very confident that once people take the necessary precautions, do the social distancing, wear their mask properly, do the sanitation, then with these three things alone, you know, we can make a big difference. But everybody got to internalize this and practice it. It's not just about lifting awareness with these things, it's also practicing, you know, what you know to be the right things.
Here, when you asked the question, you made the question and the comparison to other countries and seeing numbers go up and then study a lockdown, and there's a rumor going around. At this stage, is it being considered, and though we're looking at reopening the economy, is it high on the agenda of government and, of course, the task force that there may be another lockdown coming?
What I want to say is that we're evaluating, and once we see numbers, if they're really going to go very high, then we have to take the necessary measures. At this time, we are constantly, almost every day, we do a review and we monitor the cases. We send teams out to make sure that, you know, we have a handle on what is going on. And for example, in Region 8, where we had a number of cases, a cluster of cases, we have been able so far to bring that under fairly good control. So 1 week ago, we had a spike there. Now, because of the measures we took, we are bringing that under control. We have a spike in 7, and we are taking the necessary measures there. We have a spike in 9, and again, we are taking measures there. So sometimes the approach would be differential, depending on where we are seeing these spikes and what we need to do there. We are taking the appropriate measures there.
Right. Prime Minister, let me bring you back into the conversation. And as we're talking about that, we're looking at opening the economy and with the new restrictions, well, the new measures added. Could you explain to us what are the key parts that were updated as of the 14th for the nation going forward in terms of the curfew from 9 to 5 in certain areas? And what do the measures, how will the measures help us to safely reopen the economy?
Well, you see, the principle here is that we have to find the right balance. We cannot have a lockdown and no activities on the business side. You know, government must continue its work, but we have to find the right balance where we adhere to the measures outlined by Dr. Frank Anthony as we approach work. And that is why, you know, in these measures we have, you know, like in the public service, you want 50% of the workers will be at work at any one time, while the other 50% will be at home, and they rotate. And that itself will help in ensuring the safety of, you know, the distancing that is required at place of work. I mean, you wear your mask and you have the safety distance between workers. You know, in business places, you have the limitations that is placed at business places too. In other words, the business can continue, but in keeping with the measures. You wear your mask, you have so many people at one time in any indoor premises, you know, in order to prevent people from getting too close to each other and contaminate each other. In places of worship, we have the places of worship open again. However, the restrictions, the measures are in force. So we're slowly reaching to a point, I don't like to use the term opening up again, but allowing the activities of the people to go on, but in a measured way and in keeping with the health measures outlined by the Minister of Health and his officials.
Gentlemen, in about 2 weeks, government is supposed to present a budget 21 days from last Monday for the next 2 weeks. Dr. Anthony, we're talking about spending. Yes, we've gotten collaborations. Prime Minister, we've gotten collaborations. But there is some amount of spending that will be required from the Ministry of Health, and then of course, Prime Minister, you've got a few sectors under your ministry. Dr. Anthony, let me ask you first: what is the Ministry of Health looking for in terms of figures to adequately deal with the pandemic, and then of course deal with the other issues that come with the Ministry of Health? What are you looking for within the next few months before a full budget is read in 2021?
Well, we're working on those numbers, but certainly in terms of our response, we'll have to get the right amount of resources to respond to the pandemic. I've been assured by the President and Prime Minister that those resources, whatever we need to fight this disease, would be placed at our disposal. And so far, we have been getting, the resources that we need. In addition to that, one of the things that we would urgently have to do is put a lot of money to buy drugs and medical supplies. You might be surprised to know that since 2017, the Ministry of Health did not really place a significant order for drugs and medical supplies, which means that a lot of the medicines that people depend on are short in the system. So people, who have chronic non-communicable diseases, things like diabetes, hypertension, and so forth, many of them, when they go to their health centers, have not been able to get these medication because they have been in acute shortage for, almost a year. And these are things that we now would have to remedy because, we need to help our population. A lot of them, and as you would know, with COVID-19, people with comorbidities, meaning that they have other diseases, would be more vulnerable. And if they're not getting their medication, it would put them at additional risk. So for us, our priority is to get the resources to deal with COVID, but we also need resources to replenish the damage that was done in terms of our medicines. We don't have enough medicines. We don't have enough of the supplies that are needed. And programs like our HIV programs are in jeopardy because kits that you need to test people for HIV, we don't have them. All of it has run short. Antiretroviral drugs that we need to treat our patients, those have been in short supply. In many cases, they have gone, we don't have any. So the protocols that we have designed and how we're treating patients for HIV, that program is in a severe risk. And right now we are doing quantifications, and we'll have to go out urgently to make sure that we have those medicines for people who are affected by these diseases. TB is another area. Many of the tuberculosis drugs that we need for those patients are in short supply. So the sector, we work with sick people. And one of the ways that you help sick people is to give them medication. And if you don't have those medication in the system, we can have all the doctors and nurses, but if we don't have the medication to help people, then we'll have severe shortcomings in what we are doing. So for us, we have some significant priority, and we have made that known. We are quantifying that need, and we'll make sure that is in the next budget.
Your ministry comes up, telecommunications, communication, and a few others falling underneath different sectors. What are you looking for in terms of a budget?
Well, what we're looking for in terms of a budget, under telecommunications, I can tell you up front, we're looking to have governance expanded throughout Guyana, not only on the coast, but to reach our hinterland regions or remote regions. So we have ICT, that's project that is ongoing, and that will be ramped up for the rest of this year, so we can have the expansion of the e-governance on the telecommunications. On the energy, we want to ensure that we have, adequate power supply to meet the demands for the rest of the year, and it must also be reliable. Of course, that's in the short term. In the long term, we hope to expand and increase the megawatts available to people as business expanding Guyana, and there are some other areas that I will mention later, but definitely for the rest of this year, we want to ensure that we could supply reliable power to the people of Guyana under the energy sector. In terms of CDC, which falls under me too, the budget for the CDC is being tweaked to support the efforts of the COVID-19 pandemic, and as I mentioned before, the relief efforts to get into areas of Guyana and deliver relief to the vulnerable communities, and also to cater for any other disasters or complex emergencies that will demand a response from government. And basically, that is it for me. Of course, I will continue working in other areas, supporters of the Office of the President. But from a budget standpoint, energy sector, telecommunications sector, and CDC are the big ones. And we are planning for all activities that will take us to the end of the year and any emergencies that we're likely to face between now and the end of this year.
Gentlemen, as we come down, I will not be forgiven in here by my sport people if I don't ask the question. Yes, sport has not been played for a few months. We've got some of our top junior and senior athletes here at home trying to figure out how to train. Has a conversation started at the national level of the task force to help our athletes or senior cricketers or footballers get back into training as they look ahead to 2021? Because bear in mind, we've got a few of them who are still trying to qualify for the Olympics, which should have been held around this time, but in 2021 in Tokyo. Has that conversation started on sport?
Well, if you look at our cabinet, we have a lot of young people, and we have a young, vibrant Minister of Health. And I know at some time you will invite him to this program, and he will give you the details. But I can tell you, working with youths and working on keeping our sportsmen active is part of our directive, and it will be budgeted for the remainder of 2020.
Dr. Antti, what about your ministry and working hand in hand with the Ministry of Sport, Youth and Culture at this point in time?
Well, there's a lot of connection between us and sport, because one of the ways that we can keep people healthy is to ensure that they're fit. And so I think there's a nexus there in terms of how we can promote fitness, how we can get people to exercise. A challenge that we also have in this country is one of obesity. Too many people, we consume more than we are using in terms of physical exercise, and that results in obesity. And obesity put a lot of people at risk for heart disease and a whole host of other things. So there is that nexus, and we want to work to ensure that our population remain healthy, and therefore we'll work closely with the Ministry of Culture, Youth and Sports. The question that you asked pertaining to how do we prepare our elite athletes so that they can go out and perform, we have allowed so far, using the guidelines, we have allowed enough time period for exercise. That's one of the things that we have relaxed, and therefore they should take advantage of that to make sure that they're exercising and keeping their game up. However, in terms of if it's a team sport, then there would be some guidelines that would have to be in place to make sure, again, that people are doing these things in a safe way. And so we will continue those conversations. What we are hoping for is that in every area we can design adequate guidelines to guide the relevant sector. So with sportsmen and women, what would be the guidelines to them? And team sport, what would be those guidelines? And we really don't have to reinvent a lot of these things. They exist. Other countries have been using them, and what we need to do is to adapt some of these protocols to our conditions. And so we'll be working with the relevant ministries and sectors to be able to put those protocols and guidelines together.
As we come down to the close, final thoughts from you. What do you want to say to the population? Then I defer to Prime Minister Phillips right after.
My key thing is...
Dr. Anthony, then Dr. Phillips.
Yes. Yeah. My key thing is that we need to promote prevention, and we need to stay safe. So how do we prevent COVID from being transmitted? Simple. It's a respiratory virus, so if we use our mask and we use it properly, then we will be protected and we will be protecting others. A lot of people are still not using their mask properly. They wear it on their chin, they wear it below their nose, and that's not going to protect you. So we want people to wear their mask properly. Secondly, we want people, when they're in spaces where you have a number of other persons, that you maintain your social distance, because this is going to protect you from being infected. So maintain that social distance. And we also want people to ensure that they sanitize their hands regularly, because one of the things with COVID-19, when you cough, those droplets can contaminate surfaces. And if you touch those surfaces, then you can accidentally pick up those virus and you contaminate yourself. So I want people to be safe, but to be safe and for all of us to be safe, we all would have to practice these preventative measures. We got to keep repeating it so that people can start practicing it. There's still too many people that are not taking this thing serious. And we are hoping that we can change that attitude, and we want to recruit others, influencers in various areas, whether you're a pandit, whether you're a priest, whether you're imam. We want all those faith leaders to come on board to help us spread that message. There are many community leaders who can also help us to spread that message. So whoever can help us to take that message out, we want to work with you. And because this thing is not just about one ministry or the other or the government, and everybody is excluded. For us to be safe, it is a collaborative effort. And if we all work together, we will be able to defeat the COVID-19.
Thank you very much, Minister of Health, Dr. Frank Anthony. Prime Minister, closing thoughts.
Well, certainly I want to start by thanking the international and regional donor agencies, like the UNDP, PAHO, CARICOM, and the Caribbean Disaster Emergency Management Agency for the support they are giving to us, this new government in Guyana, in dealing with COVID-19. I would like to also thank the local private sector for continuing to support us as we deal with the COVID-19 pandemic. To the people of Guyana, I wish to let you know that based on my readings, COVID-19 is likely to be with us for the remainder of 2020 and way into 2021. So we have to practice the measures outlined by Dr. Frank Anthony and the Ministry of Health officials, outlined by our media. Let us practice. Let us show leadership. We at the government level, we are showing leadership in this whole fight against the COVID-19, and we expect throughout the public service, throughout the private sector, in the communities, whether it's on the coastline, whether it's in the interior, the leaders in those communities, exercise, as I said, leadership and help us to get everyone to understand the importance of the measures, the health measures, wearing the mask, social distancing, and once we have the education, the encouragement, and the engagement of the people to ensure that we adhere to the measures, that itself will help the ministry effort. It will help the government. And of course, we have as outlined before, we have a whole of government approach to dealing with this pandemic. So it's not the government alone, the private sector, but the people, all the people of Guyana. All of us are vulnerable, and all of us must adhere to the measures. And if we do that collectively, we will curb the spread of COVID-19 in Guyana.
Prime Minister Brigadier Mark Phillips and Minister of Health Dr. Frank Anthony. Gentlemen, thank you very much for joining us. Best wishes to your government, and it's a long road ahead to reopen the economy and keep Guyana safe. On behalf of all of us here, we want to leave you with a video that shows you how to correctly wear your mask in public. And to remember, be safe and try to be your brother's keeper and try to keep us all safe. Do have a good one.
Do you know how to wear a non-medical fabric mask safely? Here are some guidelines you should follow. First, clean your hands before touching the mask. Inspect the mask for any damage or if dirty. Adjust the mask to your face without leaving gaps on the sides. Ensure you cover your mouth, nose, and chin. Avoid touching the mask while wearing it. Before removing the mask, clean your hands and remove the mask by the straps behind the ear or head. Then pull the mask away from your face. Store the mask in a clean plastic resealable bag if it is not dirty or wet and you plan to reuse it. Remove the mask by the straps when taking it out of the bag to reuse. Wash the mask in soap or detergent, preferably with hot water, at least once a day. And lastly, clean your hands after removing the mask. A message from the Ministry of Health in collaboration with PAHO WHO. For more information, visit our website at www.health.gov.gy or visit our Facebook, Instagram, or Twitter page.